So there are cases where glaucoma can be mistaken for other things. So for example, there are patients who have high intraocular pressures. Our standard is that intraocular pressures typically should not read above 20, but there are patients whose intraocular pressures just naturally read above 20. And through, testing, we may determine that, hey, that 20 is totally normal for that patient. And they may have something called ocular hypertension, where the pressure inside of their eyes simply reads a little high, but that's not causing any disease process inside of their eyes. Similarly, we may look in the back of somebody's eye and determine that their optic nerve cups look a little large. That may be normal for that person. They may have been born that way with a naturally larger appearing optic nerve cup. We call that physiologic cupping. Again, we need to do more advanced testing to determine that that is that person's normal and not part of a disease process. And then sort of another thing that we do when we're screening somebody for glaucoma is we do tests of somebody's peripheral vision. And there are certain defects that can show up on that peripheral vision testing that can mimic glaucoma. So again, this is where it's so critical to, be coming in for yearly eye exams and have a, skilled eye care provider looking at these tests, analyzing them, and determining if any of these tests are abnormal, if it's a sign of glaucoma or if it could possibly be something else.